This is Scott Becker with the Becker Private Equity and Business Podcast. Today's discussion is Medicare Advantage. What a debacle. So this grows out of there's a great piece in the Wall Street Journal this weekend about how Medicare Advantage insurers billed the government for $15 billion or so in unneeded nurse visits. Now, Medicare Advantage itself, the idea was, oh my goodness, we're going to turn over part of Medicare to insurance companies as middlemen, and they will sort of manage care, and ultimately this will lead to cost savings and better delivery of Medicare. And of course, like all things, the addition of a middleman to almost anything is never a good idea, at least not in the insurance and Medicare world. Medicare is one of the most beloved programs by the American public. It works overall really well. It's, of course, expensive, but not as expensive as Medicare Advantage. So here is sort of my take on this. Like many government programs, the Medicare Advantage program now operates far differently than it was anticipated. For example, the Medicare Advantage program costs the government far more than traditional Medicare and limits patient choice. It also hurts health systems and doctors. More and more people hate it. From a political perspective, it's grown to being more than half of Medicare, and that's partly because Trump was for it, then Biden, after getting talked to by the insurance companies, got behind it. What a debacle. So he was influenced to become pro-Medicare Advantage too. The insurance companies cleaned up for a few years on Medicare Advantage for all the wrong reasons. Medicare loss ratios went way down, thus they cleaned up from not doing procedures. The rest of us got killed on it and are being taken advantage of. Again, today's discussion, Medicare Advantage, one of the great debacles of our time. Thank you for listening to the Becker Private Equity and Business Podcast. Feel free to text Scott Becker, 773-766-5322. Thank you very, very much.